Today is Friday, April 23rd. Welcome to this edition of Nevada County Now. Today's episode, we're talking volunteering, Tai Chi, camping, and more. Hello and welcome to Nevada County Now. I'm your host, Cole Pettit. There are several events to take advantage of tomorrow before the cooler weather moves in, including Bear Yuba Land Trust Nature Fest, which we mentioned last week. Nevada City is holding their Green Waste Disposal Day, and there's World Tai Chi Healing Day, which is held from 9 a.m. to 11 a.m. at Pioneer Park in Nevada City. The Gold Country Kiwanis will be sponsoring the event, which is also organized annually in over 100 cities and 80 nations worldwide. The event is free, but donations are encouraged, and all donations will go to the Gold Country Senior Service Center. Homer Nottingham, a Qigong and Tai Chi master, will be leading the event. He was kind enough to drop by the studio and gave me a brief demonstration of what Harvard Health publication calls moving meditation. All right, so I'm joined by Homer Nottingham, who is going to be leading the World Tai Chi celebration on Saturday. And that's at Pioneer Park, right?
That'll be at Pioneer Park. We start at 9 in the morning. The entire community is invited.
And what is that all about? It's World Tai Chi Day?
Yeah, all the way around the world that day, Cole, we're going to be doing, as it says on my shirt, a World Tai Chi and Qigong Day. And we're going to be doing the day for world healing. As you know, there's a lot of turmoil going on in the world right now, too many shootings in our schools and various things. So we're going to be working for World Healing Day. And all the way around the world that day, in every city in the world, they'll be doing Tai Chi and Qigong, bringing good thoughts for world healing. These are simple moves, so if I want to start out, we'll just open the door into the world of Tai Chi. So basically we'll go very slow, just bring the hands up, and then we come down. Now don't let the knees come forward, like you're sitting on a chair, you come down slowly. It is a wonderful thing, and we've been doing it for a lot of years, and it seems to work. We have very few, we were doing it for one world, one breath, like it says on here. We have very few wars going on now, so the world has got together as far as wars and things are going. We have a few scrimmages going on in different spots, but no major world wars and things like we used to have. So we hope that it continues to work that way.
Yeah, definitely. Yeah. So you said everyone's invited, so I don't have to be a Tai Chi master if I want to show up?
No, it's very easy. Everything's in slow motion. It's real easy to follow. Tai Chi, they've been doing it for about 5,000 years. In written form, about 10,000 years they've been doing it. It's all over the Eastern and the Orient. It's a preventative system to prevent people from getting sick. Here, the left hand will be by your belt and the right hand will be up by your ear. We're going to step out with that foot on the toe. These are martial art movements. Now we're going to brush knee and we're going to push with the right hand.
Yeah, it certainly felt very good. Can you tell us one more time, what time and where on Saturday?
9 o'clock on Saturday. Pioneer Park will be at the band shell, or right near the band shell. You'll see us out there. There'll be a couple of hundred people. And we're going to have a raffle. We'll have all kinds of raffle. The merchants in town have given us some wonderful raffle gifts. We've got a $100 gift certificate from Tuffanelli's, $100 from Friar Tuck's. These are gift certificates for dinner for four. We've got all kinds of gift baskets. Yvonne Docker gave us some real nice Tai Chi cups, coffee cups. So we have a lot of prizes. We're going to be raffling them off. And any money we make will go to the new senior center in Grass Valley over at the Summertime Restaurant that needs to be remodeled. So we're raising funds that day for the new senior center in our community, which is going to be a great thing. So please come and join us and enjoy the day. You'll find it's really a very rewarding day.
Thanks, Homer. We've seen an increase of 68 COVID-19 cases since last week, bringing our total to 4,505 confirmed cases. 88 cases are currently active with 2 hospitalizations, and the death toll remains at 75. According to the state's data, our adjusted case rate dropped down to 7.1, and our test positivity also dropped to 3.1%. But we remain in the red tier for now. For more on the current COVID situation and vaccines, let's hear from Heather Heckler, Public Information Officer for the County of Nevada. All right, so today I'm joined by Heather Heckler, Public Information Officer for the County of Nevada, who's filling in for Taylor today, who's on vacation. Thanks for coming in today, Heather.
Thank you so much for having me. I'm excited to be here.
Yeah. So what's going on in the world of COVID from the county's perspective?
From the county's perspective, very much the same as last week. Essentially, we're continuing in that red tier. We have about 7 to 10 cases, daily cases we're seeing each day, which puts us solidly in that red tier of the state's blueprint for a safer economy. I don't believe we'll be going back to the purple tier anytime soon, but we do need to continue to be vigilant on really protecting ourselves and our family members and friends from this virus. We have administered approximately 65,000 doses of COVID-19 vaccine in the community, which is a great number, and we really appreciate community members coming out for those vaccines. Of the 18 plus members of our community, about a third have been vaccinated. And with our 65 plus, our seniors in our community, over 50% of seniors have received the first dose at least. For those who aren't vaccinated yet, and whether you're wondering, maybe you have some questions about why you should get vaccinated or the safety of vaccines, these are really safe, effective vaccines. They have been shown to really completely prevent death, and then really preventing those bad symptoms of COVID-19, the really harsh symptoms that people are seeing. I think one thing that has shown how effective these are is that the case rate in our senior population has really gone down since the vaccine started rolling out and since so many folks have been vaccinated. So really, we're seeing more cases in people in their 30s, people who haven't yet been vaccinated. And we would really like those folks to, for the protection of your friends, your family, your neighbors, your grandmother, who you want to hug this year, go get vaccinated. It's safe and it's effective. So we release appointments at noon on Fridays, and those appointments go very quickly. And this is another thing I would encourage folks to do. Not all of us have access to the internet. Not all of us have that time available on Fridays at noon. But if you have a friend or family member or neighbor who you can do that for, I would really encourage you to help someone else get that appointment. It's really important now to do that. And all you really need to be able to do that is to know their schedule and their availability. And if they do have an insurance policy, the vaccine is completely free for anyone, but you will need to enter that information. So yes, appointments released at noon on Fridays for Whispering Pines, which is a Pfizer clinic, which means anyone 16 and over can be vaccinated there. We also, Docomo's has joined My Turn at this point, so you can schedule your appointment for Docomo's there, and more and more people will be, vaccinators will be joining My Turn. In the meantime, we have created a website, mynevadacounty.com/getvaccinated, where we have a list of all of the different vaccinating partners in our community. And you can go there and see the best way to schedule your appointment through those vaccinators.
Thanks, Heather. Also in COVID news, during this week's media Q&A with public health officials, they addressed some of the concerns raised by those who are vaccine hesitant, as well as the problems we may face should we not vaccinate enough of our residents, and why our numbers here are higher than the rest of the states.
Both males and females in that age group are hesitant overall in California. And some of it is related, we're told, to misinformation that they are getting, concerns about fertility. I guess there must be some misinformation out there that the vaccines affect fertility. And others are folks who are working and don't want to take time off to be vaccinated and are hearing about the side effects. And some people are quite sick with the side effects for a day or two, and they don't want to experience that. So we need to develop messages to address those concerns. I think it is a positive thing that we heard today that the federal government is going to give tax breaks to businesses to allow their workers to take 48 hours off to get vaccinated and suffer those side effects. So hopefully that will help address some of that vaccine hesitancy.
I mean, there's no crystal ball, but what does the future look like in a county where, say, 50% don't get vaccinated? What does life look like, say, in the fall? Thanks.
Thanks, Claudia. It looks bad. You can print that or announce it. It doesn't look good at all. And as Glenn is, want to talk about, the virus is replicating billions of times, and some of those replications are problematic mutations. And so, having that primordial soup of replications out there doesn't bode well for both this county and wherever you happen to visit. And so, yeah, it's problematic. And I've always thought that immunization and mask wearing is an act of charity. I mean, you do it for yourself, I get that, but you also do it for the folks you come in contact with. So it's become readily apparent now that if you have been immunized, it's very unlikely you're going to spread it to other people that you come in contact with. So that's the kind of messaging we'd like to say. It's an act of charity. It's an act of compassion.
With our numbers being elevated and higher than the state's numbers, are there any other factors that go into that that contribute to that besides non-compliance?
I mean, this is not rocket science. Every disease has got a mode of transmission. Polio and rotavirus is diarrhea disease. Ebola is skin contact. Flu, coughing. That's the reason masks work. Why in the world didn't we have any flu this season? Simply because we wear masks. Yeah. You can do comparative analysis of countries and states who have done a good job, and the results speak for themselves. Lancet had an article that even if we followed European Union the way they mobilized, which was a kind of marginal effort, but if we had done just simple measures like that, we'd cut our death rate by 40% here in the United States. So it's public health 101 or epidemiology 101. Wear a mask, social distance, wash your hands, and this virus is unlikely to spread. So if we got higher numbers, more social contact, restaurants, bar or two is open. Kids are meeting and greeting before and after schools. They're probably not transmitting in the classrooms, but there's ample opportunities in this county to spread the virus, and say the numbers speak for themselves.
And for those of us who read the world news, there are object lessons all over the world. India had the virus almost totally under control. And now they are having people dying in parking lots waiting to be admitted into hospitals. And if you look at their curve, it's a straight vertical line of cases and deaths. And what happened was they had it almost under control, and then people relaxed. They started having parties and getting together, and it's a very crowded country anyway. And now the virus is out of control again. And that has happened in Brazil. That's happening in France. So it's, as Dr. Kellerman says, it's not rocket science. If we all social distance, wash our hands, mask, the virus goes down, and vaccinate. If we don't, then the infections go up. Fortunately, in this country, because we have good medical care, deaths haven't gone up. But certainly infections can go up.
Volunteering has a myriad of benefits both for your community and the organizations you work with. But did you know it can also improve your health? Kimberly Parker, Executive Director of the Sierra Nevada Memorial Hospital Foundation, is here to tell us more.
Hello, everyone, and welcome. I thought I would talk to you a little bit today about something you might not associate with health, volunteering. As we are at the end of National Volunteer Week, I thought that I would speak to you a little bit about the health impacts of volunteering. So when we volunteer, we always tend to think about how we're doing service to others. But are you familiar with the fact that when you volunteer, number one, it's been found that it can help reduce depression. Let's just start there. And as we've come out of COVID, we've discovered that a lot of people are dealing with a lot of depression and anxiety. But because when you volunteer, you're doing service for others and you're interacting and you're building friendships and such, they find that this puts you in a better frame of mind. And especially for people 65 and older, this has been really, really important. It also plays a really important role in stress reduction. By spending time in service, you're more active and you're thinking. And so, again, these are avenues for how you interact with others. And so those seem kind of commonplace, but it also can have an impact on chronic disease management. So it's actually been shown, and I'll use an example of coronary artery disease, that Duke University did a study. And what they found with that is that those that had had a heart attack and that started volunteering afterwards, that there were two mitigating factors that really were affected: despair and depression. And these two mitigating factors, when they found that that was reduced, those are two of the biggest mortality issues for coronary artery disease. And so they actually found that volunteering was really great for heart patients. Now, there's a variety of ways you can volunteer in your community, whether it is through your church or a nonprofit or, a service club or something you just have passion for. But I also want to make sure you know that you can volunteer at the hospital for the hospital auxiliary. And in fact, in early June, they're going to be doing interviews for new hospital auxiliary volunteers. Or we also can always use great volunteers at the hospital foundation. And we use people for mailings and events and a whole wide variety of activities. You can find information on our website at www.supportsierranevada.org or by calling us at 530-477-9700. Whatever you do, think about volunteering as we come out of COVID-19. It's a great way to stay healthy.
Thanks, Kimberly. Prescription Take-Back Day is also this Saturday, the 24th, from 10 a.m. to 2 p.m. at locations in Grass Valley, Nevada City, Penn Valley, and Auburn. The event is free and confidential. They will accept prescriptions, over-the-counter medications, veterinary medications, and vaping devices and cartridges, but the batteries must be removed from those. They will not take sharps or lancets, no medical waste, aerosols, or hydrogen peroxide, and no marijuana, cocaine, etc. For more information, refer to the flyer posted on the county's Twitter page. Warm temperatures and blue skies means it's time to visit the Tahoe National Forest, right? Well, sort of. There's still plenty of snow in the Tahoe National Forest high country, and many recreation sites are still closed or inaccessible in April. Additionally, recreation managers and wildland firefighters are preparing for a busy summer season in 2021, one that's already beginning with the early warm temperatures. This year, the Tahoe National Forest is again asking visitors to please recreate responsibly, which means campfires must be attended at all times, and a California campfire permit is required. Make sure your campfire is out before you leave. Douse it with water, stir and feel for warmth. Repeat the above steps as necessary. If there's no trash can, it's your responsibility to pack out all trash when you leave, including toilet paper when no restroom facilities exist. Most campsites are booked in advance. You may not secure a campground without a reservation. To reserve a Tahoe National Forest campsite, please visit recreation.gov. During the spring, roads may be passable in the morning, but muddy and impassable as temperatures warm during the day. Don't get stuck or damage roads. And of course, rivers and lakes are cold this time of year and flows are high. Cold, high flows can kill. So be careful. A list of current open campgrounds and or dates they will be open is available on the Tahoe National Forest website, which is listed below. April is National Poetry Month, and many organizations are holding events to celebrate, including the Nevada County Library, who will be hosting their virtual poetry cafe, an open mic type slam jam poetry reading coming together celebration via Zoom. It runs from 10 to 11:30 a.m. tomorrow, Saturday the 24th. Sign up to attend by visiting mynevadacounty.com/library. We'll leave you tonight with a poetry reading from local poet Molly Fisk, reading a couple selections from her first book, Listening to Winter. And remember, stay safe, take care of each other. We'll see you next week.
Early December, dusk, and the sky slips down the rungs of its blue ladder into indigo. A late quarter moon hangs above the ridge like a broken plate and shines on us all, on the new deputy almost asleep in his 4x4, lulled by the crackling song of the dispatcher, on the bartender, slowly wiping a glass and racking it, one eye checking the game. It shines down on the fox's red and gray life as he stills, a shadow beside someone's gate, listening to winter. Its pale gaze caresses the lovers, curled together under a quilt, dreaming alone, and shines on the scattered ashes of terrible fires, on the owl's black flight, on the whelks, on the murmuring kelp, on the whale that washed up 6 weeks ago at the base of the dunes, and it shines on the backhoe that buried her. Jupiter. I wake up at 4 with the bright white beads of a headache strung behind my eyes, shifting and clicking, an abacus counting out sorrows. Click, I am alone. Click, I haven't had children yet. Will anyone know me or love me? Regret. All morning I count change into the outstretched hands of strangers, as if I were spilling the letters of my name into their open palms, expecting a flicker of recognition. I bag their maps and books, give half a smile, directions. I wonder when my life will turn out. Where's the assurance we had as kids, when things made sense, and dinner time always came at dusk, a call from the porch, the pale globes of wiffle balls glowing like moons at the lawn's shadowy edge. Outside the windows it's black and cool for August. Sagittarius chases the scorpion slowly across the southern sky. In Latin, the word for planet is wanderer. Jupiter pulls at the end of his orbit, invisibly leashed to the sun. But from here, it looks like he's weaving, drunk, among the mythical pictures. Hunter, bears, dog, virgin, drawn by people already centuries dead. Night after night, I watch him roam, and in every American town, there are others lying flat-backed in wheat fields and ballparks, empty lots, or leaning against a window like this, with a glass still half full of water, aspirin swallowed, foreheads pressed to the dark.